In this tutorial, we'll take a look at the knee joint as an example of a typical synovial joint. Synovial joints are freely movable and the bones are separated by a joint cavity. There are different types of synovial joints, and the knee is primarily a hinge joint, meaning that movement at the joint is confined to a single plane, similar to the hinge on a door. However, when the knee is flexed, it's also capable of slight rotation and lateral gliding, so it doesn't fit 100% into the description of a hinge joint. Here, we're looking at the anterior perspective of the left knee, and the first bone involved here, which is highlighted, is the femur. The articulating surfaces of the femur are the condyles. And this is the lateral and the medial condyle of the femur. And the other bone of the knee joint that we can see here is the tibia. And again, we have lateral and medial condyles of the tibia. So here's the lateral condyle of the tibia and the medial condyle of the tibia. The articulating surfaces of these bones are covered by articular cartilage, which is composed of hyaline cartilage. The next structures we'll look at are the menisci. And here we see the lateral meniscus. So here's the lateral meniscus and the medial meniscus right here. The menisci are a pair of fibrocartilage pads which are located on the condyles of the tibia. They act as cushions between the articulating surfaces, and they continuously change shape to conform as the femur moves. They also help to stabilize the knee by preventing lateral dislocation of the knee. Next, we're going to take a look at some of the ligaments that work together to stabilize the knee joint. When we look deep into the knee joint, the most obvious ligaments that we see are these two ligaments right here that form an X or a cross shaped. And these are called the cruciate ligaments. And cruciate is derived from the Latin word for cross, because the two ligaments cross over each other. The anterior cruciate ligament, or the ACL, which I've highlighted here, runs from the posterior femur to the anterior tibia, and vice versa for the posterior cruciate ligament, which is now highlighted. The cruciate ligaments limit anterior and posterior movement of the femur on the tibia. There are also collateral ligaments on either side of the joint. So first we have the fibular collateral ligament that's here highlighted in blue. This runs from the fibula to the femur on the lateral side of the leg, and it prevents hyperadduction at the knee. So it prevents excessive movement in this direction. And then we have the tibial collateral ligament, which is highlighted here. And this runs from the tibia to the femur and prevents hyperabduction of the knee. So this prevents movement or excessive movement in this direction. Next, we'll take a look at the superficial surface of this joint. The anterior surface of the joint is covered by the tendon of the quadriceps muscle, which is highlighted here in purple. And this tendon embeds the patella and then the patellar ligament extends beyond the patella and continues inferiorly to attach on the tibial tuberosity of the tibia. We'll quickly also show you right here, we have the tibial tuberosity. And this will complete our tutorial and our tour of the synovial joint of the knee.